Artificial Intelligence Dr. www.abcpharma.net/english.net User question: can an increase in heart rate after pacemaker implantation increase blood glucose levels? Claude AI answer: an increase in heart rate after pacemaker implantation could potentially affect blood glucose levels, although the relationship is complex and can vary depending on individual factors. Here's an overview of how increased heart rate might influence blood glucose. Stress response: a sudden increase in heart rate may be perceived by the body as stress. This can trigger the release of stress hormones like cortisol and adrenaline. These hormones can increase blood glucose levels by promoting gluconeogenesis and glycogenolysis in the liver. Increased metabolism: a higher heart rate generally increases overall metabolic rate. This could lead to increased glucose utilization by tissues, potentially lowering blood glucose. However, it may also stimulate the liver to release more glucose to meet the increased energy demand. Altered cardiac output: changes in cardiac output can affect blood flow to various organs, including the pancreas and liver. This might influence insulin secretion and glucose metabolism, though the exact effects can vary. Hormonal changes: heart rate changes can affect the balance of various hormones in the body. This could indirectly influence glucose regulation through effects on insulin sensitivity or secretion. Individual factors: the impact on blood glucose can vary based on a person's overall health, pre-existing conditions, like diabetes, medication use, and other factors. It's important to note that while these mechanisms exist, the overall effect on blood glucose levels may not be clinically significant in many cases. Pacemakers are generally programmed to mimic natural heart rhythms and rates, which should minimize dramatic changes in metabolism or stress responses. For patients with diabetes or pre-existing glucose regulation issues, it's advisable to monitor blood glucose levels more closely after pacemaker implantation and discuss any concerns with their healthcare provider. The body often adapts to the pacemaker over time, and any initial fluctuations in blood glucose may stabilize. Would you like more information on any specific aspect of this relationship between heart rate and blood glucose, or about pacemaker adjustments that might be made to optimize metabolic health?